So, Dr. Vaishali, you are ready?
Yes, sir.
The time starts now. 3 minutes.
Good morning. I am Dr. Vaishali, one of the child doctors working in this hospital. I believe I'm speaking to Monica, mother of Raina.
Yes, Doctor, I'm Monica, Rana's mom.
Nice to meet you, Monica, and thank you for sparing some time of yours. Uh, Monica, I today I am here to address your concerns and talk to you regarding Raina. Is it okay with you today?
Yes, Doctor.
I would like to, before we start, I would like to ask you if anybody would like to join this meet.
Doctor, right now I'm all alone, so you can start.
All right, so that's absolutely fine. So today, uh, Monica, I would like to know is do you have any concerns about Raina?
Yes, Doctor, Rana is having this rash on
Okay.
her buttock and on her legs and on her arm. And
Mm-hmm.
she was also complaining of pain in her ankles. And
All
that's
right.
why I came here. And when I asked one of the nursing staff about what about her updates, then she told me that Dr. Vaishali will be coming to update you about Raina's condition.
Yes, that's absolutely fine. And today I am here to address all your concerns and discuss with you about Raina. Mrs. Monica, we have examined Raina and we have, on physical examination and seeing the rash, we have come to a conclusion that she is suffering from a condition which is called as a henoch-schonlein purpura. Have you heard about it before?
No, doctor, I'm hearing it for the first time.
All right. So let me explain you about some more details about henoch-schonlein purpura. Is that okay with you?
Yes, doctor.
Okay. So now, what does this henoch-schonlein purpura means? What happens is that there are certain small blood vessels in our body, and these blood vessels they get irritated and they get swollen. Especially, this happens in the small vessels of the skin, the gut, and the kidneys. And that is the reason why we see this rash. Are you understanding me? Are you with me?
Yes, doctor, I'm following you.
Yes. So this is how Raina has got this rash because of the swollen and irritable small blood vessels. So what happens is generally it has been seen that generally children between 2 to 11 years of age, they get this kind of rash, and especially following a viral infection or a bacterial infection, but most probably it is a upper respiratory tract infection that happens, and after following that they get this rash. Am I making myself clear, Miss Monica?
Yes, doctor. So,
And it is,
as you told,
yes.
so if it is because of any infection, so doctor, please give her some antibiotics.
Yes, that's a very good question, and I really appreciate the concern of yours, Miss Monica. But let me tell you that this is because of the viral infection that this has happened, and we would like to investigate her by doing certain blood tests and some urine tests, and get her admitted so that we can observe her for some few days. Is that
So, doctor, you mean to say that you are still not sure that Raina is having this henoch-schonlein purpura?
Yes, so that's a very good question that you have asked. See, the thing is that there are certain bacterial infections which also cause this kind of rash. So we need to get her investigated by doing a blood test and a urine test. See, we have, by physical examination, we have come to a diagnosis that this is a henoch-schonlein purpura by physical exam. However, we would like to get her blood test done and urine test done, as I already mentioned to you.
So, doctor, will she be admitted in hospital for the
Uh,
investigations and for the treatment?
See, we have seen that Raina is a well child, so she need not get admitted in the hospital. But this is at the discretion of the pediatric consultant to decide whether he wants to observe the child for the rash, or he would like to discharge the patient. Is that okay with you?
Okay, doctor. So, doctor, is it something serious that I should be worried
Uh,
about?
Mrs. Monica, this is not serious. This is a viral infection, so it is actually not very serious condition. This is being seen very commonly after a viral infection, and predominantly it is seen mostly in boys rather than the girls. But
3 minutes.
yes, and what we will do is we will refer you once we are assured that she is absolutely fine. We will refer her back to the GP for her review with the GP every week, and GP will take her blood pressure and check her urine every morning for next 4 weeks. Is that okay?
So you mean to say that that the Vina will be kept under follow-up for a long time?
Yes, she will be kept
For how long?
because what? See, she will be kept under observation. I mean, for a follow up. For initially, every week she needs to go to the GP for BP and urine checkup for every week for 4 weeks, and after that she needs to go every fortnightly for 12 weeks.
Okay, doctor.
All right. So, am I am I clear? Mrs.
Yes,
Monica,
doctor.
am I clear?
Yes, doctor,
Okay.
you are clear.
Yeah. So let me summarize what we have spoken. Um, we have spoken about HSP, which is a small vessel inflammation of the small blood vessels of the skin, the gut, and the kidneys. Also, the cause is unknown, but it could be because of some viral and the bacterial infection, and we need to there is no specific test to diagnose this, and we need to give her a symptomatic treatment for the same. We can just give paracetamol to relieve the discomfort, and we should follow up with the GP for the blood pressure and the urine monitoring for next 4 weeks. So I guess this is quite a information for you, Mrs. Monica. And but let me reassure you that you need not retain all the information. I will give you some written information, and also you can. If you have any more queries, you can just write it down. We can discuss it in the um, further meetings. Is that okay with you?
Okay, doctor.
Okay.
Thank you,
Thank you,
doctor.
Mrs. Thank you so much.
Okay. Okay, doctor. Further, you give feedback.
You tell me to give feedback, then you don't give any feedback.
You you are working in UK and you are doing com every day. So I think you are the
Oh,
best person to give feedback. I'll be giving after that.
Dr. Vishal's empathy is really good. You just need to sound a bit confident, and for that you don't use those words like or kind of like what we normally do. So to sound like more confident and not to say those words, say the sentence in your mind and then verbalize it.
Okay.
So instead of saying ah oh, say just the moment you are about to say that, just give a pause. So
Pause.
that
Okay.
looks much better. That looks much better. And the best part about you, Dr. Vaishali, is that you are very confident in while you were speaking to me. So that is actually needed uh,
Yes,
when you are
and
doing
she is
comp.
very empathic. She is
Yes,
like super, super empathetic. Like,
yes.
I, I would not say anything otherwise about it.
Okay, but few of the information you gave wrong. Okay, so I
Okay.
ask you that as it is because of some infection, so why don't you give an antibiotic? So you have to say that why it happens, we exactly don't know. Okay,
Okay.
and antibugs are not recommended when child is having HSP. Okay,
Mm-hmm.
and then when I ask you about follow-up, that for how long Raina will be in follow-up, then you gave wrong information. So that depends on urine dipstick result. So
Okay.
uh, if dipstick is showing less or equal to 1 plus protein and blood, then the follow-up will be by GP in 1 to 2 weeks, and then there will be monthly BP measurement, which you mentioned weekly. I think you mentioned weekly, and
Mm-hmm.
then weekly urine for protein. Okay, till urine is free of protein. So that we will be doing. But if urine dipstick showing more than or equal to 1 plus protein and RBCs, then the follow-up will be at hospital at a children's OPD, and rest things are same.
All right.
Rest all things seems means that BP needs to be measured every month and urine dipstick every week till urine is free of protein.
Okay.
Okay.
So there is no specific time frame, no, sir?
So if it is less or equal to 1, then we monitor it for 6 months.
Okay. Understood.
And if at the end of 6 months BP is normal and urine is free of proteins, then we discharge child from follow-up.
Okay.
Okay. But if protein urea is persisting even after 6 months, then we will be referring that child to pediatric nephrologist. That you have to keep in mind. So if at presentation child presents to you with macroscopic uh, hematuria and uh, proteinuria, then you have to refer that child to pediatric nephrologist. Or if there is renal failure at the time of presentation, then also you have to send that child to pediatric nephrologist. So read HSP from guidelines that this HSP
Mhm.
is very important. You may get HSP in COM, and you can get HSP in videos also.
Okay.
I have a doubt, but there is no need for indication of steroids in this case, as child had any pain abdomen and arthritis.
If there is severe pain abdomen, then we will be starting with steroids. We will be starting with prednisolone in a dose of 1 milligram per kg per day for 14 days, 2 weeks. Okay. And for pain, if pain is severe enough, then the first line is ibuprofen. So you and Dr. Vaishali, you mentioned paracetamol. So you have to mention that we will be giving ibuprofen. Okay, for that.
Sir, in some of the literature, it is mentioned that ibuprofen should not be given in HSP because it might cause a kidney damage. So, preferably a paracetamol. So, I do not
So
know whether only paracetamol or both the drugs can be given.
so ibuprofen is first choice. What they have written in pediatric guidelines that you have to give.
Uh-huh. Okay.
Okay.
All right.
But you have to, but if child is in renal failure, then definitely you won't be giving that. If child is
Correct.
asthmatic, then definitely you won't be giving that. But if all
Right.
these things are not there, then
Mm-hmm.
you will be giving for pain relief. Okay.
Understood.
So 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 in HSP there will be rash. There will be palpable purpuric rash. It is more on extensor surface of legs, buttocks, and on back of hands. There will be GI involvement in the form of uh, non-specific pain, and it usually settles. This abdominal pain usually settles in 2 to 3 days. If it doesn't settle in 2 to 3 days, then we have to start with the steroids, and that we have discussed. We will be giving prednisolone in a dose of 1 milligram per kg per day for 14 days. Okay, and then there will be uh, arthritis. So for that, we will be giving ibuprofen in a dose of 10 mg is the standard dose
Per
that we
kg.
give.
Yeah. Hmm.
And then what more is there? Mm, in neurological involvement, headache is common, so that you have to keep in mind. And then renal involvement is very common. So macroscopic hematuria is important, and proteinuria is very important.
Important.
So it is not always present at a time of presentation, so that you have to keep in mind. So it may present initially
Mm-hmm.
at 4 to 6 weeks. So that's why we measure BP, and that's why we do dipstick. Okay, because
Mm-hmm.
we are scared of renal involvement. Okay,
Understood. Yeah.
so
So another question I want.
uh,
Mhm.
it's because of renal involvement that we check
Mhm.
blood pressure, that we do dipstick, and
Mhm.
that's why we keep these
Mhm.
children in follow up. Okay, and if
Okay.
mother asks you that will my child land up into renal failure,
Mhm.
then you have to say that uh, that yes, renal failure is one of the complication of HSP, but I would like to tell you that it is very rare. It occurs in less than 1% of children who develop this HSP. But what we will be doing is that we will be keeping Raina in follow up. We will be regularly checking her BP. We will be regularly checking her urine, so that we can pick it up early if it develops, and we will take appropriate measures for that. Okay, something
So
like
I
that you
have
have to
a question.
explain.
Yeah. I have another question. What if the mother says this rash is of a meningococcal rash? So then, how do you counsel the mother that this is not a meningococcal rash and this is a HSP?
So you have to say that yes, I can see that you are very much concerned about Raina, and you should be. But I would like to tell you that this rash is not consistent with meningococcal rash because Raina is not having fever, and she is not sick. Okay.
So we can say that the rash, the fever, headache, maybe neck
See,
stiffness, associated.
see, a child with meningococcal rash is sick looking, and a
Hmm.
child with HSP rash is not sick looking.
Well,
Plus, you
yes,
can, yes, plus you can differentiate both from the distribution of rash. Okay. So this HSP rash is
HSP.
palpable, purpura, but
Hmm.
meningococcal rash is not palpable. Okay, it is purpuric. Okay, and with time it causes necrosis of the skin also, but that in advanced stage. So that you
Correct.
have to keep in mind. And HSP rash distribution is very characteristic. It is present on extensor surface of legs, on buttocks, and on back of hands. So
Correct.
that differentiates from it.
So what if the mother says that I have done a glass test on this rash? I know that this is meningococcal rash. Then what do we say?
Yes. So you say that yes, this rash doesn't blanch with pressure like meningococcal rash, but we tend to check other signs also to label it whether it is HSP or not. So what other examination we have done based on that, it is HSP rash. But this mother
Dr.
won't be asking. But if
Hmm.
you have to explain this to medical student, then that medical student may be asking you.
Mm-hmm.
Dr. Vaisale, if
Mm-hmm.
this communication is with a mother, don't
Mm-hmm.
go into so technical terms like
Yes.
high grade fever, headache, neck stiffness. Don't go into
Okay.
those sort of terms. If
Mm-hmm.
this is with a student or with a nurse, then
Mm-hmm.
you can go into those. So
Okay.
just you can simplify it by saying that we
Looking.
see a lot of patient who is coming with meningococcal rashes. Your concern is very valid in thinking that it is same, but I would like to assure you by saying that child who present with those meningococcal rashes are systematically so unwell, and your child does not have those presentation. But to assure you more, we are going to run some investigations which will give us some clue if it is that or not.
All right. Understood. Thank you so much, Dr. Farah. So, but I say a lot of ooh. It just comes out.
No, no, that is a look, Dr. Vaishali, that is a habit, and
Yeah.
we all tend to have those habits because we are not like speaking in English since our birth.
Mm-hmm.
It's our second language, or for some, it is even
Yes.
third language.
Mm-hmm.
So to like minimize those effect, if you say the same sentence, but if you are saying it in a, if you are thinking of it, if you are thinking of the sentence before saying it, or if you pause yourself before you do that, then you can rectify that.
Correct.